Community Champions of this year. Lovely to see you all again. I think there's still a couple of people joining, so thanks once again to Hannah for sharing the screen for us this morning and sorting out the slides, and just a quick welcome back to Tracy. Tracy, do you want to give us a wave?
Thank you. Trust me to get COVID. But I'm back now, thank you.
Happens to the best of us, Tracy. Happens to the best of us. Okay. So should we go on to the agenda, please? So as ever, this meeting is being recorded. Please do ask us any questions. You may have lots of questions. Next slide, please. And today we have Steve, who's come to do the data update. We may or may not have Emma to do the Omicron update. I'm sure Steve can do that for us as well. And we've got George and Darsha updating us on the guidance, the vaccinations and the comms. We've just got half an hour today, so without further ado, we shall move on to the next slide, please. And the next slide, please, and hand over to Steve.
Okay, thanks, Kerry. I will whiz through the data slides and try and concentrate more on the Omicron situation. So, but as you can see in this slide, no great change in our case rates. We've gone zigzagging up and down around the 300, high 300s, low 400s for quite a while now, and that's where we are currently. We're roughly around 380 cases per 100,000 of the last 7 days. Move to the next slide, please. As you can see on this is comparing Wakefield with the rest of our West Yorkshire neighbours. We've got the highest case rate across West Yorkshire, and we have had for several weeks now. But actually, we've got one of the lowest over 60 case rates, which is really good news. And we have, as you can see, the red bars indicating upwards trajectory for Leeds, Calderdale, and Bradford. But overall, they still remain in a fairly similar position to Wakefield. But I'll come back on the 60 plus in a little while. So if you just move to the next slide, please. I won't dwell on this one. This just shows how we compare with positivity. So that's the proportion of tests that come back positive, and on the right, our testing rates. And positivity rates is we are roughly around the same as the England average. So that's roughly 1 in 10 tests comes back positive. And on testing, we are a little way below the national picture, but we are very consistent with West Yorkshire, which is shows that people are still continuing to go out and access tests when they need to. Okay, next slide, please, Hannah. This doesn't show us a great deal. This is just testing rates by age groups, so I think we can just flip on to the next one, please. And this is more interesting. This is our case rates by age group. So the darker the colour, the more cases we have in that age group. And you can see at the bottom 2 very dark lines. That's the 5 to 10s and 11 to 16-year-olds. That's where we have the highest case rates. So we're still seeing some transmission in those age ranges and school settings. But the more positive news, and I touched on this around the over 60s, is towards the top, the 60 to 79-year-old bar and the 80 plus bar are much lighter colour, and that's because the boosters have been largely going very well in those age ranges, and that's been driving down case rates and indeed serious cases in those age groups. So that's a really positive. That you can very clearly see the booster program helping people. Next slide, please. This is just an age comparison of what our case rates look like. On the right, these are called population pyramids. On the right, you can see our cases over the last 3 months, and the widest bar you can see there is the 10 to 19-year-olds, females on the left, males on the right. And on the most recent 7 days, this will fluctuate, but you can just see a slightly different pattern, and you can see more cases in the 30 to 39-year-old age group. That may change, but you can see how that could be reflective of a slightly different picture, which we'll continue to monitor. And if you move to the next slide, please. So this is our age ranges again. over time. This time you can see the yellow is the highest, so this is the 5 to 10-year-olds. That's higher than secondary school age range, but very similar. The one to really look at though is the over 60 rate, and you can see it doesn't look as dramatic on here, but if you're sure, but you can see a consistent reduction in the number of cases in the 60 plus age range. Those are the people more likely to end up in a hospital, so that's a really positive reduction, and that's largely because of the booster program. And we're seeing that pattern not just in Wakefield, we're seeing that all across the country, which is really helpful. Next slide, please. I think we can skip past that. That doesn't show us a great deal. This is by deprivation. So, and again, this is our local patches, so you can spot your own local areas. But actually, it's fairly consistent. We do know that places come up and down fairly quickly, so don't be too concerned if your area is higher than other areas, but don't be complacent if it's lower either, because it does fluctuate fairly rapidly. But if you look on the next slide, you can see how Wakefield and compares to nationally. The more purple, darker colours are the highest case rates. So we've been quite often at the forefront of the high case rates in our patch and our West Yorkshire neighbours. Actually, we're looking slightly better than a national picture at the minute, but this is all going to change with the advent of Omicron. So if we just move on one slide, this is our local picture, and as I said before, this is just the same data on a map. You can see which areas are looking like slightly higher case rates, but this does change very rapidly. And next slide, please, is long COVID. I want to just, I haven't got a lot of time, so I want to just move on from those. We can just flick through that, please. Hospital admissions, as I've said, I've come down well, so you can see that mirrors the reduction in the over 60s age range, which is good. And if we keep on moving, deaths, again, sadly, we still do get COVID deaths, but they're far lower numbers. And then with vaccination slide, which I won't dwell on, but just to say, actually, we're doing really well, continue to do really well, and encouraging people to take the boosters. It does make a difference against Delta, and in the light of Omicron is even more important, as you'll no doubt be aware of the national drive now to get as many people boosted as it is possible to do. But I want to spend the next just a couple of minutes just talking about Omicron. There's lots out there in the news. The big picture is this is a concerning picture for nationally. So the COVID level has been increased to level 4, which is the next but highest level that we can be at. It is very spreading very rapidly, mainly in London at the minute, but it is spreading rapidly across all parts of the country. It is the spread in London is very much in the community. This is not just linked to travel. It's not just linked to particular types of settings, like a school, for example. This is across communities. And we're starting to see that pattern in other areas. The good news for now is that Yorkshire and Humber and Wakefield are actually quite low levels, we think, but actually the nature of this thing is it spreads very, very rapidly indeed. So we really don't want to be complacent. We really do need to push those messages around using face coverings, trying to be cautious in the run up to Christmas is really, really important. In the next couple of days, we suspect that nationally the Omicron will become the dominant variant. It will be more than 50% of the cases in the next few days. So there have been changes to isolation guidance. So because Omicron was so worrying to start with, and it still is a very worrying situation, then if you were a contact of an Omicron case, you had to isolate regardless of your vaccination status. Now that's changed. That's gone back to what it was. You don't need to isolate if you are a contact of any variant of COVID, if you are fully vaccinated or you're under 18 years and 6 months. However, you are strongly advised It's not a legal requirement. You are strongly advised, if you are a contact of a case, to do lateral flow testing on a daily basis for 7 days or until you come out of isolation period. And you are also requested to limit your social contacts. For example, really try and negotiate to not come into work or work in an area where you're less in contact with anybody who's vulnerable, and try and limit your social contacts. But they are all requests and guidance, not legal mandates. There's that's going to obviously put pressure on LFTs, and you'll have seen lots of news about LFTs. There are LFTs out there. There is stock there. There may be some logistical issues getting it to people, but and that will be pressured from now until Christmas, because clearly people will want to do tests before they go and visit relatives or go to events, which is exactly what we want people to do. The COVID passports have come into play today for say various things, which is you need either vaccination status to be proven or a negative LFT test. My advice is you can do one or the other. I'd do both. If you're vaccinated and you're going to visit somebody who's vulnerable, or you're going to go out for a night out, I'd take an LFT test before you go, as well as even if you are vaccinated. The more barriers we get in place, the better. And just, I suppose that's it largely on terms of Omicron. We do continue to watch our local picture very carefully. There's obviously a lot of discussion around how severe Omicron is and whether it's milder. Now we hope it is, and we hope, looking back, this will be an important turning point in the pandemic. But we can't be sure of that, and because of the pace that this thing spreads, that even if lots of people become infected and need to isolate, that might mean that they're missing socializing, they might be missing families, they may not be able to come into work. Plus, it will mean that some people who are severely impacted may also surge into hospital at the same time, putting even more pressure on a very pressured health and care system. So it is vitally important that everybody tries to get boosted as quickly as possible. We're doing well, but please push that, and please try and be as careful as we can, certainly in the build-up to Christmas and the New Year. I've taken up half the meeting, so I'm gonna stop at that point. But happy to answer any questions.
Thanks, Steve. It seems very sensible to take up half the meeting with the data and the Omicron update, so no apology needed there. Does anyone have any questions about Omicron or indeed anything else for Steve? No? I guess watch this space. I suppose I have a question, which is, are we expecting any more announcements soon from a national perspective, or do you have any kind of knowledge of that, and how careful should we be in terms of kind of seeing people and going out and about? Is it Christmas party cancellation time?
And I think it's really difficult because the message is be careful. I mean, we're not we don't have any advance notice of any further changes. It is a very rapidly changing situation. It feels, if you all remember what it felt like in March 2020 when the pandemic first broke, guidance changed almost every day, and we're not quite back at that place, but we are in a position with Omicron as being very serious that we just need to keep ahead of the science and keep ahead of understanding what's happening. So guidance could change at any moment, depending on what we're finding. Does that answer your question, Kerry? There might be a second one.
Yeah, I think so. Cancelling the Christmas party was the other question.
Yes, of course. It's really tricky. I think you've got to think about the risks and benefits and what's the most valuable part of Christmas. I have cancelled some, personally, I have cancelled some things I wanted to do, visiting friends that we've not seen, we don't see very often, but we wanted to see them before Christmas. We've cancelled that this weekend, cancelled my team in-person Christmas event. And so and that's the kind of cautious, because what we don't want to do If you get positive from now on, then you will be in isolation over Christmas, because now today's the 15th. So if your 10 days starts tomorrow, then you're isolated on Christmas Day. So that's why I think you've got to think about the knock-on effects of being infectious, and are some of those events worthwhile.
Great, thank you, Steve. Anything else anybody would like to ask Steve? Thanks very much, Steve. Okay, if we can move on to the next slide, please. If anybody does have any other questions, just pop them in the chat. We'll just hand over to Darsha for a vaccination update. As Steve said, this is a really important part of what's happening at the moment. So, and that has also changed quite a lot in the last week. So do you want to just give us a quick run through, Darsha?
Yes, thank you. So it is, as Kerry says, the activity has been really ramped up over the booster vaccinations and general vaccination in response to the Omicron variant. Last week, I was mentioning the things that were changing around booster vaccinations and also vaccinations in other cohorts. The operational letter to NHS has been issued, and from Monday, we have opened online bookings for those who are 13 and above. And from today, it has been open for those who are 18 and over. So anyone who is 18 and over can now book their booster on the National Booking Service. Similar to lateral flow test, I think you may have seen in the media that there is quite a lot of demand. The line is quite busy on the booking process, but it does go quickly and does refresh itself fairly regularly. Extra appointments are being made available in centres across Wakefield area, and we are working round the clock to get people jabbed as quickly as possible. What would be really helpful if we could ask for people to book as many appointments as possible, just to help us navigate the demand rather than just walk-ins, but obviously walk-ins are still available. I'll pop into the chat the link to booking vaccination, but I've also put at the on this slide the TCG vaccination information that you can see. In terms of 12 to 15-year-olds, the second doses will be offered via a mixed model of in-school and in vaccination centres. It is looking at around the 12-week gap that we mentioned that will be in between dose 1 and dose 2. We are also told that we can co-administer with HPV as well as flu. So if there are young people or parents who are thinking that their school are in the rolling program of administering other vaccines, the second dose of COVID vaccine can be co-delivered with that. The other thing to mention is also the suspension of the 15-minute wait post Pfizer and Moderna. And there is a link at the bottom of the slide that gives more information for anyone who can read up on it. And it is due to the Omicron variant and really accelerating the booster program. As part of that, the wait has been suspended so that we have much more time to deal with the vaccination, but also it is based on information that we now have, and having got much more experience of giving the vaccinations over millions of people. So as guidance is updated, that will be changing. So anyone attending now will start seeing the difference. And that's it.
Brilliant, Darsha. Thank you. Any questions for Darsha? Lovely. We will move on then. George, the floor is yours.
Okay, so we've had updated guidance because Plan B has been brought into being. So if you could just go on to the next slide. So face coverings are now necessary in most indoor settings. And don't go to the next slide, but on the next slide I've given a link so that you can see where where it is necessary and where it's not necessary. Workers should be working from home. If they can work from home, it's guidance. They don't have to. If they want to work in the office, they can work in the office. But everyone that is able to work from home is requested to work from home if possible. And then coming into being as from today are the COVID passes. So they are required in nightclubs, dance halls and discotheques, any venue that's open between 1 a.m. and 5 a.m., any venue serving alcohol after 1 a.m., any venue with a dance floor, and any venue that's providing music, whether that's live or recorded. So if you just go on to the next slide. So here are the links. So there's a general government page, the coronavirus page there. That's got all the general information. Then there's the information on the face coverings. I've just missed a heading out there for the final link. That is all about the COVID pass, that final link there. Okay, so yeah, if we move on to the next slide. Okay, so our Christmas campaign then. So we've adopted the colour of red to go with the theme of Christmas. So if you want to move on to the next slide, it's all the campaign is Let's Keep Life Moving This Winter, and we've done what we call assets on all the behaviours. So we've got Santa washing his hands. Next slide. We've got a young lad there sanitising his hands, and with them all, as you can see, we've got I sanitize my excuse me. I sanitize my hands to keep my community safe. So we've personalised all the assets as we were doing previously. We've got the mask wearing. Next slide. Testing. Next slide. Getting the vaccine. Next slide. Checking into the app is another one. Next slide. And then ventilation. So opening, we can see opening a window there. So next slide. So this is for a specific Christmas campaign. Just hang on a second, don't play yet. This is a specific Christmas campaign we've done. So it's again on the 6 behaviours, but we've produced a series of gifts to try to increase the likelihood of people stopping scrolling and then reading the message. So if you want to play. And then next slide. Next slide. And then this is the actual message that goes with that gift. So it's all about Santa having his booster, having a test, and that he's going to be making a delivery. So it's quite humorous, you know, to try and increase sort of, you know, people's engagement with us. So next slide. I've just got another example. So this is for Christmas Day. So we've got the family there enjoying Christmas with a fairy opening the window for ventilation, and then the text that goes with it. You know, if you're having visitors, remember to open your windows and doors, keep a flow of air to keep COVID-19 at bay. Okay, next slide. And then just one final one for you. This is, and then on to the next slide. So this is Boxing Day. So it's to promote people to get tested. We hope you had a good day, you know, for Christmas. You know, if you met up with people, you know, get a test, make sure that you've got the all clear. So the gift is people celebrating a negative test. Okay, and then next slide. And then that's it. That's it from me. Thank you.
Thank you, George. That's great. And some of those are kind of really nice images. We'll put some of those in the WhatsApp group as well, and people will receive them on the follow-up email. George, there's just a question in the chat about a comms team developing a Christmas activity pack for young people this year, which is something that happened last year, but I don't think there's anything like that planned, is there, this year?
Christmas activity pack.
For young people.
I will look into it whether or not we can revive the previous pack and use that again, but we haven't actually planned one for this year now. I'll see if we
Okay.
can. I'll see if there is one from last year though.
Thanks, George. Much appreciated. Okay, so just to wrap up then, everybody, are there any other questions or anything that anybody would like to say? Would anyone like to share how people are feeling in their communities or their organisations?
Hi, Kerry.
Hi.
Hi,
Sophie.
Sophie. Hi, you okay?
Hi,
I've just got a question. I think it'd be mainly for Dasha. So I picked up some feedback yesterday of somebody who attended the Spectrum for a booked booster vaccination. The appointment was at 12 at noon and had to wait 2 hours. It was a carer as well. So they had to wait 2 hours before they were seen for the vaccine. So in total, they spent 2.5 hours at the centre. They did feel like, is this the queuing going to put people off? People that were turning up and then turning away because of the long queues. This person had already booked, but also still had to wait. And also the other feedback I've had so far is a lot of people don't know that they will be getting a different vaccine to the ones that they've had before. And will we be providing some information and literature on that? Because it is panicking people about the side effects from a different vaccine to the one they've had before. So the staff are having to go over that with each person that's coming up for the booster, but there seems to be no written information or anything sent to people before they attend the clinics.
Great question, Sophie. Dasha, do you know the answers?
Excuse me. So in terms of the 2-hour wait for an appointment, I will need to pick that one up because clearly it's not good enough for a person to be queuing for 2 hours, especially as we are in winter months. And it is a booked appointment rather than walk-in.
Great.
I think the system is just trying to reconnect. Hopefully it won't crash. In terms of the call for people to book appointments, I think that is where we are trying to get as many booked in rather than walk-ins to make sure that it can be dealt with on at the time of the vaccine. But I will pick that one up with the navigation walk. As in respect of the different vaccine, we have got quite a few comms that have been shared. So I can share that if it will be useful again with COVID community champions, just to share the messaging. It will be either a full dose of the Pfizer vaccine or half dose of the Moderna vaccine, as the two that have been allocated for and deemed most suitable for vaccinations for boosters. However, there are some exceptions on clinical grounds as well. The discussions at the beginning of the vaccination process itself, where a person is sitting with a clinician, that discussion will take place each time with every patient, because you need to have that informed consent and inform the patient what is happening to them. So that discussion is a normal part of it. But was it perhaps more that at that point the person is perhaps a little bit more worried in terms of the side effects? So patient leaflets and information will be happening.
I think it mostly was actually that they panicked. They were just assuming I'm turning up for my booster. It's number 3. I'm going to get the same one, because previously you had to have the same one, didn't you? The booster with the first vaccine and the second one was the same make. So they're turning up to the clinic expecting the same one, and then all of a sudden you're told it's not. And I think it's just the unknown. And I think if there's something out there before the people book the appointment or they know about it, it probably will make the experience a bit more easy. But happy to talk to you afterwards, Dasha.
Yeah, but
happy to share some of those comms, Dasha, as well. I'm just conscious that Steve's waiting to come in.
Yeah.
It was only just to say that, I mean, it's really important that we try and share that, because actually that's a potential barrier for people taking up the booster, isn't it? And it's but the evidence is, it's not just about supply. The evidence is that having a different vaccination will really help. So particularly if you had AstraZeneca's doesn't look to be that good at Omicron. So actually, if you've had 2 AstraZenecas, I have, then having a different one really helps. Side effects, I think that's a challenge, because nobody wants to roll up before they go to a family Christmas event and then end up feeling poorly the next day. It is not everybody gets side effects. Some people do, some people don't. I had mine last Friday. It put me in bed for a few hours. It does happen, and that's part of people's considerations. But it's trying to do the right thing, but not trying to disrupt your Christmas, isn't it? It's a really difficult. The timing of this is not particularly helpful, but it's trying to get people to come forward as soon as they can, but and try and assure them that any side effects are self-limiting, and it may affect you, but it hopefully it'll only be for a short amount of time, and then it helps protect you in the longer term.
Okay, thanks, Steve. Any further questions or clarifications, please do get in touch with us. Lindsay, I'll pick up your question outside, and we'll do some emailing around that in terms of support sessions for people with mental health issues. Has anyone got any other questions before we wrap up, or anything else they want to say?
Another question, Kerry, but can I just add on that one, on Lindsay's point, that some of our other vaccination centres have made adjustments to make sure that those who need perhaps a quieter area can have their appointment tailored. So whether it was an early start or late finish, that they have tried to do that. Also, if there is anything specific for a particular person, if we perhaps take it through our contact us email address, and then we can have a look whether we can provide additional information to somebody booking an appointment, or make some arrangements in the local centre.
That's fine. I shall pick up and do an email round Robin, and we'll see if we can get that sorted for the people who are asking. Thank you very much. Okay, so I guess it just falls to me to close the meetings for this year. The next meeting is we're going to do 2 half-hour meetings every month for the first few months, to see how we go with Omicron and to see what kind of interest there is. So the next meeting is planned for Wednesday, the 12th of January. So look out for some links and invitations coming your way. I just want to say thank you to everybody for taking part in this process, for being here still, for supporting your communities, for asking us questions, for providing suggestions. It means a huge amount to us. Please look after your emotional and physical well-being over Christmas. Look after each other, be kind to each other. If people need any help, then please do get in touch with us. And obviously we've got a great network of partners, voluntary sector partners who are there to support people. So thank you very much. Very Merry Christmas, everybody. I hope you all get to spend time with your loved ones and you get to do exactly what you want to be doing. And I'll see you on the other side of Christmas and New Year.
Merry Christmas, everyone. Thank you.
Thank you.